Hi everyone, I'm Dr. Ben Hazen, and I wanted to talk to you about the cases of measles we're seeing in our community. I'm going to share what to watch for and how to protect your family. I know hearing about a measles outbreak can be scary, but the more you know, the better you can protect yourself and your loved ones. So let's talk about measles, what it looks like, how it spreads, and most importantly, what you can do about it. First, let's talk about what to watch for. Measles doesn't show up right away. Anywhere from 6 to 21 days after someone's exposed, they'll start feeling sick. You'll see a high fever. It could be as high as 104 or even 105 degrees. And they'll feel really lousy and run down. Then they can develop a cough, runny nose, and red, watery eyes. Most people say it feels like the worst cold they've ever had. Something unique about measles is about 2 to 3 days after these symptoms start, you might see tiny white spots inside the mouth, especially inside the cheeks. We call these Koplik spots, and they're little white dots with red rings around them. Then about 3 to 5 days after symptoms begin, they'll develop a rash. It starts on the face, these little red spots that might join together, and then spreads down the neck, trunk, arms, legs, and feet. As it spreads down, the fever often spikes even higher. The whole rash process takes about a week, and then it fades in the same order that it appeared. Now here's what worries me as your pediatrician. Measles can be really serious, especially for little ones under 5, pregnant women, and anyone with a weakened immune system. Sometimes measles can get much worse, and we see ear infections, pneumonia, and in rare cases, brain inflammation. That's why we take this so seriously. Okay, now let's talk about spread, because measles is incredibly contagious. If somebody with measles walks into a room, the virus can hang in the air for up to 2 hours after they leave. It spreads through tiny droplets when someone coughs or sneezes. People are contagious from about 4 days before the rash appears to 4 days after. So someone can be spreading measles before they even know they have it. Let me put this into perspective. Measles is so contagious that if one person has it, 9 out of 10 people close to them who aren't immune will catch it. That's a 90% transmission rate. Compare that to the flu, which is only about a 20 to 30% transmission rate. This is why we're taking this outbreak so seriously. So what can you do? The number one thing, and I cannot stress this enough, is to make sure you and your family are vaccinated. The MMR vaccine is incredibly safe and effective. Kids need 2 doses, one at 12 months and then another at 4 years old. If you're not sure about your vaccination status or want to vaccinate early, call us or check for more information on our website. If there's measles in our community and you're not vaccinated or not sure, avoid crowded indoor places when possible, wash your hands frequently for at least 20 seconds with soap, and don't touch your face with unwashed hands. Frankly, that's good advice for anyone. If you think you or your child might have been exposed to measles, call our office right away. We can arrange to see you in a way that keeps everyone safe. We care about each and every one of your families. Measles is preventable. We have the tools to stop this outbreak, but we need everyone's help. We're here for you, and we're going to keep our community healthy. If you have questions, please don't hesitate to reach out. Take care of yourselves, and thank you for doing your part.